To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Well, hey there, everybody, and welcome to Your Health. Today, we are going to talk about shockwave therapy because I am joined by Dr. Brandon Deardahl from Integrity Health and Wellness. Hey, doctor.
Hi.
Let's get into it. Shockwave therapy. It kind of sounds space age, so I'm curious what it is, but first, what should I be feeling to consider shockwave therapy?
Yeah, exactly. So it's really ideal for chronic pain. So if you've been experiencing something for more than a month or so, that's a really good time. And anything from nagging shoulder pain, one of the other things that it's really successful for and is actually designed for is plantar fasciitis. So more of those tendonitis, those itis things that people might be diagnosed with.
And are you finding that a lot of people have just lived their life coping with this pain and not thinking they can do anything about it?
Yeah, absolutely. And the mission of our office is to help people naturally, without drugs, without surgery. And so if that's something that you're really looking for, it's a good solution for that as well.
So, because it sounds pretty cool, I did want to figure out what does the process look like. So let's say I've got that shoulder pain and it's been around for 6 weeks. I come in, I see you, what happens?
So first we'll do an evaluation. We'll talk about your history, if you've tried anything else before you came into the office. And then we might take some x-rays just depending on the nature of the injury. And then if we feel like you're an ideal candidate, we would go on ahead and we would treat you that day. We'd have you come back, see how you respond, and then I would custom tailor a treatment plan for you to see what we can do for you.
And as it relates to the actual shockwave therapy, is it something that we put on? Are there patches? Is it gels? How does that work?
Yeah, so it looks kind of like an ultrasound wand, and it's applied directly to the skin. We put ultrasound gel right on the skin over the affected area, and then we're basically going to take that transmitter and put it right around that affected area.
And then that transmitter will beam waves into that tissue.
Exactly. So it doesn't use electricity in the actual treatment itself. It uses acoustic waves. So it's just bursts of sound waves that are going deep into the tissues.
And in our last few seconds, how many treatments or when should be a realistic time that I would feel better?
Yeah, so 4 to 6 weeks is pretty typical for most healing, and it can accelerate that healing, but we're looking at 8 to 12 visits on average, and each session only takes about 5 to 10 minutes.
Well, doctor, thanks for beating that chronic pain that we have, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.